Picture this. You go to your doctor. She holds up a scan of your coronary arteries and points to areas of buildup. Calcium deposits, narrowed passages, the early stages of a problem that kills more Americans than any other disease. She prescribes a statin, tells you to watch your diet, and sends you on your way. And you leave thinking, is that really all there is? Because somewhere in the back of your mind, you've heard that what you eat can either hurt or help those arteries. You just haven't been told the specifics. Here's what almost nobody is telling you. A common kitchen ingredient that costs under $2 at any grocery store has now been studied in randomized controlled trials specifically for its effect on coronary artery plaque. And the results are something most cardiologists aren't bringing up at routine appointments. Not because they don't care, but because the research is newer than most medical training. And the ingredient in question doesn't come with a pharmaceutical sales rep knocking on anyone's door. I'm Dr. Sarah Mitchell, and this channel exists to close that gap, bringing you the latest peer-reviewed research on natural cardiovascular strategies, designed specifically for adults over 60 who want real answers, not generic advice. If you're not subscribed yet, hit that button now, because what I'm sharing today is the kind of information that takes years of medical literature to track down, and I'm condensing it into the next 15 minutes for you. The ingredient is garlic. Now, before you click away, this is not about eating more garlic bread, not about garlic powder on your chicken. The specific form and preparation method matter enormously, and getting this wrong means getting none of the benefits. Stay with me, because the distinction is everything. Let's start with what's actually happening in your arteries, because understanding the mechanism changes how seriously you'll take what comes next. Atherosclerosis, the medical term for plaque buildup, doesn't develop because you ate one too many eggs. It develops because of a process that begins with inflammation in the arterial wall itself. Your artery lining, called the endothelium, becomes damaged over years of exposure to oxidative stress, elevated blood sugar, smoking, and chronic low-grade inflammation. Once that lining is damaged, it becomes sticky. LDL cholesterol, the kind associated with plaque, begins to accumulate in those damaged areas. White blood cells rush in to try to repair the damage, but they get trapped in the arterial wall, accumulate fat, and harden into the deposits we call plaque. So cholesterol is often more passenger than driver. The fire that gets things started is inflammation. And that is precisely where garlic does something remarkable. Margaret was 67 when her cardiologist showed her the results of her coronary CT scan. There was measurable calcification in two of her major coronary arteries. Her doctor prescribed a statin and recommended dietary changes. She followed both instructions faithfully. But at her 6-month follow-up, she asked about additional options. Her doctor mentioned, somewhat offhandedly, that some data existed on aged garlic extract and arterial health. Margaret went home and spent 3 weeks reading through the research herself. She found the clinical trials I'm about to share with you. She started a specific protocol with her cardiologist's awareness and approval. 14 months later, her follow-up imaging showed something her cardiologist described as remarkable. The progression of her coronary calcification had completely stopped. Her C-reactive protein, which is a blood marker of systemic inflammation, had dropped by 38%. She's 71 now, still on the protocol, still monitoring. So what is garlic actually doing inside your body? The key compound is called allicin. When you crush or mince a raw garlic clove, two substances that are naturally kept separate inside the clove, an enzyme called alliinase and a precursor molecule called alliin, come into direct contact. The reaction produces allicin, and allicin is one of the most potent anti-inflammatory, antioxidant sulfur compounds ever found in a food source. The catch is that allicin is chemically unstable. Heat destroys it within minutes. Your stomach acid degrades it before it reaches the bloodstream in meaningful amounts. So most people who eat cooked garlic, or who buy the cheap garlic capsules at a dollar store, are getting almost nothing in terms of cardiovascular benefit. The delivery mechanism determines everything. Here's what shocked me most when I dug into this research. And this is the part that changed how I talk about garlic to everyone I see. When raw garlic is aged slowly in a cold environment over a period of approximately 20 months, the unstable allicin compounds transform into something completely different. They become stable, water-soluble organosulfur compounds, the most important of which is called S-allylcysteine. These stable compounds are highly bioavailable. Your body actually absorbs and uses them efficiently. They retain the anti-inflammatory and antioxidant properties of fresh allicin, but without the instability that makes fresh garlic ineffective at reaching your arteries. This transformed product is called aged garlic extract, and it is what the clinical trials have been studying. Let me walk you through the research specifically because I want you to understand why this isn't just internet health speculation. A randomized controlled trial published in the Journal of Nutrition, conducted by researchers at the Los Angeles Biomedical Research Institute at Harbor-UCLA Medical Center, followed 55 patients who all had measurable calcium deposits in their coronary arteries. Half received aged garlic extract daily, half received a placebo. After 1 full year, the aged garlic group showed zero progression in their coronary artery calcium scores. The placebo group progressed at the expected rate. But the finding that caught everyone's attention was in a specific type of plaque called low attenuation plaque. That's the soft, unstable kind that ruptures and causes heart attacks. The garlic group saw a statistically significant reduction in soft plaque volume. That is not just slowing the problem. That is beginning to reverse it. Now, I want to pause here and ask you something. Have you ever had a coronary calcium score test done? Drop your answer in the comments below, and just your age and yes or no. It takes me a few seconds to read, and knowing what this community is actually experiencing helps me make sure I'm covering what matters most to you. Beyond the calcium data, the blood pressure research on garlic is equally compelling. A comprehensive meta-analysis published in the Journal of Integrative Blood Pressure Control reviewed 20 separate randomized controlled trials and found that garlic supplementation reduced systolic blood pressure, your top number, by an average of 8.3 millimeters of mercury. Context matters here. Many antihypertensive medications aim for a 10 to 12 millimeter reduction. Getting nearly that effect from a kitchen-derived supplement with essentially no serious side effects is not a small thing. The same analysis found diastolic blood pressure reductions averaging 5.5 millimeters of mercury. For someone sitting at borderline hypertension, say 135/85, those reductions could represent the difference between needing medication and not. But here is where the science goes somewhere most people don't expect. And this next piece is genuinely surprising. Aged garlic extract appears to directly modify the bacterial composition of your gut in ways that benefit your cardiovascular system. A 2019 study published in the journal Nutrients found that regular garlic supplementation significantly increased populations of beneficial lactobacillus and bifidobacterium bacteria while suppressing harmful species. Why does this matter for your arteries? Because your gut microbiome directly regulates systemic inflammation throughout your entire body, including in the walls of your blood vessels. Researchers now believe that gut-derived inflammation is a major contributor to atherosclerosis progression. Garlic appears to address this upstream at the level of your microbiome. That is something no statin has ever been shown to do. Additionally, garlic has a measurable antiplatelet effect. It reduces your blood's tendency to form clots. A study published in Phytomedicine found that aged garlic extract inhibited platelet aggregation by up to 58% in certain subjects. That is the same basic mechanism by which low-dose aspirin provides cardiovascular protection. These effects appear to work through a slightly different pathway than aspirin, which is why some researchers believe garlic extract may complement, not replace, aspirin therapy for appropriate patients. Frank is 74, a retired school teacher from Ohio. He'd been on a statin for 6 years, his LDL was well controlled, and on paper his numbers looked fine. But his CRP, his inflammation marker, was stubbornly elevated at 3.8. His blood pressure, despite being on medication, stayed around 148/90. He started the aged garlic protocol below with his cardiologist's knowledge. After 12 weeks, his CRP had dropped to 1.4. His blood pressure averaged 133/82. At his next appointment, his cardiologist reduced his antihypertensive dose. His doctor's exact words were, "Whatever you added, keep doing it." Now let's talk about the protocol exactly, because this is where the difference between results and disappointment lives. The specific form you need is aged garlic extract, not garlic oil capsules, not garlic powder, not deodorized garlic, not raw garlic cloves. Look for those exact words on the label. Aged garlic extract. The product used most consistently in the clinical trials I cited is Kyolic Formula 100, which is available at CVS, Walgreens, Whole Foods, and on Amazon. A 2-month supply typically runs between $8 and $12, which is where the $2 figure comes from. This is genuinely one of the most affordable cardiovascular interventions backed by actual clinical data. The dose used in the coronary calcium studies was 1,200 milligrams of aged garlic extract daily, taken in 2 divided doses. Take 600 milligrams in the morning with breakfast and 600 milligrams in the evening with dinner. Divided dosing maintains more stable blood levels of the active compounds throughout the day. If you're sensitive to supplements or have a history of digestive issues, start at 600 milligrams for the first 2 weeks, then increase to the full dose. Always take it with food. It absorbs better and is gentler on the stomach. When choosing a product, look for 3 things on the label. First, the words aged garlic extract. Second, standardization to contain S-allylcysteine. That is the key bioavailable compound your body actually uses. Third, a USP verified or NSF certified seal, which means a third-party laboratory has independently confirmed that what the label says is actually in the capsule. Quality control in supplements matters enormously, and these certifications are how you verify it. Give this protocol a minimum of 8 to 12 weeks before evaluating results. The coronary calcium studies ran for a full year to see the most dramatic effects. But inflammatory markers like CRP often begin shifting within 6 to 8 weeks. If your doctor already monitors your CRP levels, ask for a baseline measurement before you start and a follow-up at 12 weeks. Having numbers to compare keeps you and your doctor informed and gives you something concrete to track. Before you start, there are safety considerations that are non-negotiable. If you take warfarin, Plavix, aspirin, or any other blood-thinning or antiplatelet medication, speak with your physician before adding garlic extract. The antiplatelet effects of garlic are real, and combining them with existing blood thinners requires medical oversight. If you have surgery scheduled within 2 weeks, hold off on starting until afterward and stop any current garlic supplementation. Garlic's blood pressure lowering effects are meaningful. If you're on antihypertensive medication, monitor your blood pressure more frequently in the first month, particularly if you already have readings on the lower side of normal. Anyone on immunosuppressant medications should consult their doctor first as well. Garlic extract works best as part of a broader anti-inflammatory approach. Adding omega-3 fatty acids from fish oil, 2 to 4 grams daily of a quality product, produces synergistic effects on arterial inflammation. Regular walking, even just 30 minutes 5 days a week, significantly amplifies the blood pressure benefits. And reducing added sugar and refined flour, not eliminating carbohydrates entirely, just the processed, rapidly absorbed versions, substantially lowers baseline inflammation. The garlic does more when there's less fire to fight. Comment below right now. Write starting the protocol if you're planning to give this a try. Write already using garlic if you've been doing this for a while and want to share what you've noticed. I genuinely read these, and this community's experiences help shape what I cover next. Here's the core message from everything we covered today. Your arterial health is not fixed. The research shows clearly that plaque progression can be halted and, with the right approach, partially reversed, using interventions that are safe, affordable, and available to anyone. Aged garlic extract, standardized to contain S-allylcysteine, taken at 1,200 milligrams daily in divided doses, has more rigorous clinical support for cardiovascular benefit than almost any other supplement available without a prescription. The studies are peer-reviewed, the mechanisms are well understood, and the results are reproducible. If today's video opened your eyes to something your doctor hasn't mentioned, share it with someone you care about. Drop your current blood pressure reading in the comments, just the 2 numbers, so we can see what this community is working with and check back on progress together. And if you're sending this to a family member or friend who needs to hear it, write sharing this below. You might be changing someone's health trajectory with a single tap. I'm Dr. Sarah Mitchell. If you haven't subscribed yet, now is the time. Because next week I'm covering the one mineral most cardiologists say is dangerously overlooked. And when you see what happens to arterial walls when you're deficient in it, you'll want to know immediately. Stay proactive, stay curious, and I'll see you in the next one.